Hi, I'm Maggie, and I'm a senior level student here at Bryan. I'm going to be teaching you guys how to do your abdominal assessment. So first you're going to do hand hygiene, and then you're going to walk into your patient's room, do your AIDA, introduce yourself. Hi, my name's Maggie. I'm your student nurse today. I'm going to be doing your abdominal assessment. And then you're going to have your patient lay flat on their back on the bed. And then since you're exposing their stomachs, you're going to want to make sure you pull the curtains so they have that privacy. And then you're only going to expose the part of the stomach that you're assessing. So I'm just going to pull up your shirt here a little ways. Alright, so the first thing you want to do is inspect the abdomen. So you're going to check their contour. You can do that by going to the edge of the bed and then going to the side and looking at it from both ways. You want to check and see if their belly is more rounded and distended, if it's scaphoid and goes in, or if it's flat. You're next going to be checking for the symmetry. So just make sure distribution of like hair or anything is like even on all sides. And then you're going to be checking their umbilicus. You want to make sure that it doesn't look infected, that it's like in the midline. If it's off, that could be from if they've had like a C-section or anything. So you'll be looking for that as well, and you're just going to be charting everything you're finding. And then finally, you're going to be assessing their skin, whether or not they have moles, stretch marks, scars from any past surgeries, anything like that. And you'll want to document that as well as any kind of open wounds or anything. So next, we're going to auscultate. So you want to auscultate before you do any kind of poking on the belly. And we'll start in the right lower quadrant and just go in a circle. So you're listening for normal active, hyperactive, or hypoactive sounds. And then you're going to be listening for the vascular sounds as well. So you're going to want to switch your stethoscope to the bell. And then you're going to listen right at the upper center of the abdomen. And you're going to listen to their abdominal aorta for any kind of bruise, which is that whooshing sound. So you'll be listening there. And then you'll come and listen to the kidneys. And then you'll be listening to the inguinal area as well. On both sides for kidneys and inguinal. Alright. So next, we're going to do our percussing. So you'll just take your 2 fingers, place it on the abdomen, and you're going to take other 2 fingers, and you're going to tap. And you're listening for any kind of tympany or dullness in the abdomen. And if you hear like a dullness, that means there could be excess fluid buildup. Next, we're going to do our palpations. And so you're just going to take those 2 same fingers. You can do a circular motion back and forth, but you're going to start in that right lower quadrant and ask if your patient's having any kind of pain. And then for deep palpation, you're kind of going to give it a little bit more force. And for deep palpation, you're looking more for any kind of tumors, hernias, anything like that you can feel with that deep palpation. And then another one that you can do for this is checking the liver. So right under here, you're going to take your fingers and kind of feel underneath that rib cage and then put one hand behind their back. And you're just going to have them breathe normally, and then with every exhale, you're kind of going to dig a little bit deeper until you can find the edge of that liver. And then you're going to be checking for rebound tenderness. So we're going to go to the left side of the stomach, and you're going to take your 2 fingers and you're going to do a deep press into the belly and then let go super quick and ask your patient if they had pain. She's not having any pain, so that's negative for the rebound tenderness. And then I'll put her shirt back down here, and I'll have you sit up. And we're going to test for the costovertebral tenderness. So I'll take our palm, place it on the back here, and just do a little pound behind the kidneys and ask if they're having any kind of pain with that. You feel pain?
No.
And that's your abdominal assessment.